see the recording.
Okay, so I'm going to hit continue and that will be re-recording. All right, so you ready?
I'm ready. So welcome to this Tools of the Trade and the taped version of this program that was offered virtually in April. This is the new world of Zoom and online meetings and learning, and we hope that you embrace this as much as we do. As you know, this workshop is one of a series sponsored through the OSU Center for Clinical and Translational Science and is organized by Stuart Hobbs. Stuart has done a great job in leading this effort to move this program to the online format, and he is working his magic behind the curtain, troubleshooting any of our technical issues. On that note, let's embrace this e-learning opportunity, even though, as you will see, we have a few little starts and stops as we go through this presentation. So let's get started. I'm Pam Salisbury. I'm a professor in the College of Public Health and the program director for the Community Engagement Corps for the CCTS. Also a key player in the planning of this program is Cynthia Gerhardt, who is an associate professor in the College of Medicine and the director for the Center for Biobehavioral Health at Nationwide Children's Hospital. Cynthia leads the Integrating Science Special Populations Corps for the OSU CCTS. So why today's program? First, I need to say this program was planned pre-COVID-19, and while we are not going to talk specifically about that today, the subject matter of inclusiveness in research may be more important now than pre-COVID-19. This program was partially designed in response to practical concerns that arise in designing research. How do I meet inclusion requirements that continue to be stressed by NIH? Such requirements include age groups, groups across the life course, different race and ethnicity, minorities, rural populations, genders. But it was also designed in response to real concern about the inclusiveness of research subjects. It is this principle of inclusion that undergirds the NIH requirement in this area. Putting into place a principle of inclusion is key to developing and sustaining trust required between researchers and society, and in assuring that our research in science has a broad impact. Today, we are addressing two populations that present challenges to researchers, that is, older adults and persons living in rural and isolated areas. The examples will be set in the context of real research programs, but don't get waylaid by the details of their specific research. Think about how things they've learned in the implementation with these populations might apply to the projects you're currently working on or would like to work on. So again, how you can apply their lessons to your own research. We will hear from Drs. Mary Beth Happ and Dr. Karen Rose about their experience recruiting and retaining older adults in their research. And then we'll shift gears and hear about doing research in rural Ohio from Dr. Kathy Lancaster and her team, Kathy Neal and Renee McDowell, on engaging persons who use drugs. So I know that this is an engaging presentation and hope that you find it that way also. Next, I want to introduce Jeff Griever, who is the program manager for community engagement at the CCTS. And he's going to talk about the polls we took during the live version of this workshop. We asked questions about hidden populations and what was of interest to people in the audience. So Jeff, I'm going to turn it over to you.
Thanks, Pam. And thank you, Stuart, for putting it on the screen for me. Again, I'm Jeff Griever, Community Engagement Program Manager for the Center for Clinical and Translational Science. If any of you watching would like to reach out to me for any sort of support or at least get it pointed in the right direction related to engaging stakeholders in your research, I encourage you to do so. I'm going to offer my email address I'll do it now and also after I am done speaking here in a minute, just to make sure that you had a chance to get it. It is just jeff.griever at osumc.edu. Jeff, Jeff dot Griever, Grev as in Victor, ER at osumc.edu. So the polls that we asked during the live presentation in April, first wanted to get at the current research that the attendees were doing and which special populations that they were working with. So you can see on the screen that there were quite a few already working with underinsured or socioeconomically disadvantaged populations and racial and ethnic minorities. We also had several working with isolated urban and or rural communities, and infants and children, and then older adults, which is one of the populations that is addressed in our presentations to follow here. So we do, you can see the rest on the screen, but we wanted to get information about who was in attendance and what they were interested in, what they're currently working on. And then, so the next question is more related to maybe what they would like to pursue. So Stuart, if you could share the results from the second question. So we did, as I mentioned, we asked the attendees which special populations would you like to include in your research moving forward? Again, there was a lot of racial and ethnic minorities that people answered with that. Also, urban or rural communities, and the underinsured and socioeconomically disadvantaged populations, non-English speaking individuals. And so this was important for information for our presenters to hear before they got started, so that they could, if they had an opportunity, tailor some of their remarks to address anything that maybe came to mind in the moment. And also for us thinking about future programs, which leads to the third question. If we were to do another, in which we do in fact plan on doing, of these tools of the trade programs, what lifespan research topic is of most interest to you? And you can see, as you can see on the screen, the inclusion of children across development, inclusion of participants in multi-generational research. So that's across multiple generations, including grandparents and siblings, etc. And then the research methods in maternal and child health. So, you know, as you can see, there was several, and we're taking these into consideration, figure out which programs we can best deliver in the near future, given the experts that we have available to us to bring to the table. So look for those. And then we do have one more question that this was a free text response, so people wrote in what they're interested in, again, related to the population specifically, that they would like to know more about, and have more presentations similar to this one. And so we're seeing, you can see the range of answers that we received, including, again, the underrepresented populations and minorities in particular in that answer. Socioeconomic status was of interest in children, and language proficiency as well. So particularly English as it's shown there. So we're very excited to continue to offer these. So we're going to be letting you know if you're a CCTS member and you receive our newsletter, that information will be there. If you have any questions, if you have any ideas for other topics that maybe you're not seeing here, please don't hesitate to email me. As I mentioned my email earlier, you can send those ideas there, suggestions. And also if you just, again, as I mentioned, would like to receive any sort of assistance or support for your research projects and your research teams related to engaging stakeholders and other community-based practice-based support. So I did say that I'll give my email one more time, and so it's jeff.griever@osumc.edu. And please let me know if I can help in any way, or if there's any other programs you'd like to see from the community engagement program as a whole. Thanks.